Without further ado, I'd like to welcome everyone to joining us for our roundtable discussion on COVID-19 and the impact on residency programs, residents, and ABC exam candidates. Today is Friday, April 17th, and we will be sharing this presentation via the NCOPE website. My name is Chris Robinson, and I'll be your moderator today. In terms of our agenda and format, we'll have a brief introduction to our panelists as we have a pantheon of experts who will be joining us on the topic. We're also going to discuss the status of our organizations and ability to provide services to the stakeholders on this call. We're also going to go through the guidance statements by both ABC and NCOPE. But more importantly, we're going to have a bit of a dialogue with the audience as well. So as you have questions arise, please don't hesitate to take advantage of the chat window to submit questions, and we'll periodically throughout the presentation entertain those questions and make sure that we address your concerns thoroughly. Without further ado, let's go ahead and meet our panelists. Ms. Dominique Mungo, you have the floor.
Good afternoon, everyone. Again, Dominique Mungo. I'm the Director of Residency Program Services with NCOPE. I hope that you all are safe and in good health. Sam Lane.
Hello, everyone. My name is Sam Lane Kettabong, and I'm the Director of Certification Services with ABC. And again, I also echo Dominique's comment about everyone staying well and safe during this time.
Excellent. Let's go ahead and dive into our primary program. First and foremost, I'd like to just state that both ABC and NCOPE are fully operational and ready to serve. Both organizations continue to monitor the COVID-19 pandemic, and we are doing everything that we can to ensure that our programs and services are minimally affected by the challenges. Also, as we've already mentioned, the safety and well-being of everyone is quite important, including our employees, as well as candidates for examination, residents, and educational stakeholders. We recognize that this is a time that may bring some anxiety for you, your colleagues, coworkers, families, and the patients that you serve. And we hope that providing you with valuable information during this session helps alleviate some of those anxieties. Also, even after this presentation is done, please continue to revisit both the ABC as well as the ncope.org websites for updates, as we will continue to provide additional guidance as it becomes available. With regard to NCOPE, please understand that the residency standards are in place to ensure competent patient care. It is our continued responsibility and goal to hold accredited residency programs accountable to the NCOPE residency standards. I've gotten a couple of inquiries already from individuals saying, Chris, have you guys lowered the standards since COVID-19? And to that, I need to recognize that the main stakeholder is our patient, so the standards are the same. I'm going to hand things off to Ms. Mungo to discuss how some changes within your clinical setting may be affecting you, the resident.
Thank you, Chris. I will now address the impact on current residents. So in order to know where you stand in the event your hours are reduced, it's important to know that NCOPE recognizes full-time residency as a minimum of 37.5 hours per week. Part-time would be anything less than that 37.5 hours. Now, if you have moved or will move from full-time to part-time, it is likely your residency will be extended beyond what you originally intended. Now, the good news. You know, the adequate
Ms.
time
Mungo,
needed.
we had an audio blip for just a moment. My apologies. I had to mute a few individuals that were kind enough to join us, but didn't mute their microphones.
Okay. Sorry about that. All right, I'll just begin again. I think in order for you to know where you stand in the event your hours are reduced, it's important to know that NCOPE recognizes a full-time residency as 37.5 hours per week, and that's at a minimum. Part-time is anything below 37.5 hours per week. If you move from full-time to part-time hours in your residency, it is very likely your residency will be extended. Okay, so there is some good news in this. A residency program may be extended with no additional fees, and this will enable you the time necessary to achieve successful completion, and of course, in line with the NCOPE standards, as Chris mentioned earlier. However, under no circumstances will the residency be marked complete if the minimum program length is less than 12 months for a single discipline residency or less than 18 months for a dual or combined residency, okay? NCOPE, to assist you, has designed a tool, and it's available on our website, to provide you with an estimation of residency program end dates. In those instances for right now with the COVID-19 pandemic, or whenever, you know, you have to take a leave of absence or your position is even terminated. This tool is called the Residency Program Duration and Experience Calculator. And I do encourage you to go on our website and, you know, access it and kind of play around with it, as it will give you an idea of when your residency will end or how long it needs to be extended beyond your original end date. Next slide, Chris. Thank you. Continuing with the impact on current residents. Furloughed residents are being handled much like residents who, before this COVID-19 pandemic, when they would place their residencies on hold temporarily. The same goes for residents that may have lost their employment due to COVID-19. We're handling those as well, much like we would have in the event a resident lost their employment in any other circumstance. Now, in the event you are furloughed or have lost your employment, you must submit a residency status change form. This form is on our website, and you can fill it out at any time. There are specific instructions as far as how this form works and what's needed from you and your residency director. So please pay attention to those instructions. Residency duration duration and experience calculator, and mentioned in the previous slide, as well as this residency status change form, are both found within the guidance we provide about COVID-19 on our website. So you can go there to access it. Just go to the residents, residency director, and mentors and administrators section within that to find this form as well as the calculator.
Next up, I'd like to discuss the clinical experiences and additional learning resources. One thing that NCOPE is intimately aware of is the fact that we've seen a reduction in patients across outpatient as well as hospital-based practices. This is important for the social distancing to occur and to protect the interests of our patients, many of whom are vulnerable due to comorbidities and conditions that are associated with the pathologies we treat. On that note, there's many different ways you can gain important knowledge and information during your residency. You don't learn only when you're face-to-face with a resident. One of the tools that NCOPE's created is the NCOPE Residency Education Database. All residents and directors were emailed just a few weeks ago with information about how to access this free resource. But if you're thinking, I don't have access to a database, but I'd love to be able to see and learn additional online tools, lectures, videos, journal articles, you can still sign up. It's quite easy. Just visit the NCOPE website, and at the bottom of the page, you'll see the ability to log in. If you click the login button, you'll have the opportunity to create your own account and access our database resource. Furthermore, as many of you are aware, NCOPE Tracker is something that I'm quite passionate about. But I also understand that you're going to have fewer case entries per week typically than you would with a busy clinical schedule. Keep in mind that we have a tool we've built out to enable you to document relevant clinical activities that aren't just purely face-to-face patient care. So within your Forms tool, this is going to be rolling out just next week. You'll be able to actually enter experiences such as reviewing continuing education courses, peer-reviewed manuscripts, or case studies with your directors. So you'll be able to document that information. As I recognize, the typical tools within Tracker are focused very much on those face-to-face patient interactions. I'm going to hand things back to Ms. Mungo.
Thank you, Chris. In lieu of the impact on residency programs due to COVID-19, this was effective immediately. All residency programs that were set to expire prior to December 31st of this year have been granted a 90-day extension to their accreditation cycle. Now, though we cannot account for all circumstances that have occurred as a result of COVID-19, we hope that you'll find the extension helpful. And, while we just wait to return to normalcy. We'll still accept and process new and renewal applications during this time if you still wish to apply. And you may also check our website for updates as well for information related to COVID-19.
So on the screen, probably the most common question that we get from individuals is, what do I need to do with regard to communication with NCOPE and submitting documentation? This flowchart is something that's already on our website. So if you're thinking, Chris, this looks familiar, I'd say you're right. But it enables you, whether you started your residency or not, to identify if communication and dialogue is required. So I want to give you a moment to actually take a look at this image. And for those of you that happen to connect to the system after we kicked off at noon Eastern sharp, to submit your questions, please don't hesitate to send them within the Zoom meeting window, as Ms. Mungo and I are going to actually entertain a few residency-focused questions now. So please don't hesitate to submit some of those questions as we speak. And actually, one of our very first questions from one of our dedicated and committed residency directors said that we've been looking at the database and they've identified that some of the tools and resources are resources that they may have had during school. Is there any plan for more in-depth education? And actually, I posed the same question to the audience. Is there a plan for more in-depth education? The database is community sourced. It's not NCOPE providing the community a list of things that we think you need. So I actually would encourage all of you to submit to the database those updated and enhanced tools. I recognize not every residency site is actively engaged in the generation of new information and knowledge, but if you do have those resources, or you're a current resident and you found a peer-reviewed manuscript or other valuable resource, please don't hesitate to submit it. The database is only as good as the member base that contributes to it. So it's not purely a tool set for you to extract information. We want you to upload and input information as well, as that database is designed to be useful across all levels of education. And then we have another very good question. How are telehealth or patient intake / evaluations by phone accounted for? Can these be entered into NCOPE Tracker since they're direct patient interaction? Excellent question. And to that I say absolutely. This is the quintessential notion of direct patient care. While you may not be engaged in the typical psychomotor or hand things that would be associated, like grinding a socket trim line, for example, you still have that direct patient interaction piece. And I would strongly encourage you to document those, as telehealth and telemedicine has actually created some great opportunities for learning to occur. And then we have another good follow-up question. Can online resources count as hours for residents with reduced hours? Keep in mind your employment within that organization. If you continue to be an employee, but your number of hours of face-to-face patient time is reduced, you still have the capacity to offset those experiences with online components. There's actually a couple of residency sites where the residents are still full-time employed, but they can't come to the clinic because they shut down the outpatient clinic for a brief period of time. Those are instances where they're actually supplementing online resources, direct residency director and mentor-led education. So those absolutely can contribute towards the full-time status, as is the case with the clinic I mentioned already. And we have another good question. Will this new addition, recognizing the form within NCOPE Tracker to document non-clinical experiences, help prevent us from having to extend our residency if we're not engaged in seeing as many patients, but other methods of learning? And my response is possibly. Keep in mind, a full-time residency is 37.5 hours per week. And I said it that way because it's not 37.5 hours of face-to-face patient time. Those words have never existed within the standards. A full-time residency is 37.5 hours a week dedicated to learning. If you have 37.5 hours a week of learning occurring, whether it be 25 hours with the patients and another 12.5 via online resources and other applications with your director, that would contribute and count towards the full-time residency time slot. To that end, if you're only seeing 10 hours a week of patients and doing 10 hours a week of online content, in that instance, well, you're part-time, because 10 plus 10 is not 37.5 hours per week.
Thank you, Chris. So we know that this is a time of anxiety, not only for you, but also for your coworkers, families, and patients. We want to remind all of you that business continuity is ABC's main focus during this pandemic, and that although our offices are physically closed, the ABC staff is fully operational and here to help with all of your ABC needs, ranging from certification to continuing education. And I know that everyone has questions or concerns regarding the impact of COVID-19 on their exams. So my goal here today is to help answer your questions and address your concerns on these specific topics. So the first topic that I want to be discussing is the impact on current ABC candidates with updates on exam sessions. For those candidates who are registered for the April written and simulation computer-based exams, an email was sent notifying all candidates about the postponement of this session to May 4th through the 16th. This window has been extended an additional week in order to accommodate all candidates due to Prometric test centers operating at half capacity to comply with their social distancing mandates. And all candidates were sent an email on Wednesday, April 15th with your new authorization to test information. We encourage all candidates to register with Prometric immediately, as slots may be limited and they can fill up quickly. However, if you are experiencing registration issues or are unable to locate a testing center, please contact us immediately by email, and that's at certification@abcop.org. We will now discuss the June testing session. So the June testing session has also been extended an additional week due to social distancing mandates at Prometric. So the new window is now June 8th through the 20th. As a reminder, for all applicants who have submitted an application, the residency deadline is May the 1st. We are reviewing applications daily and are communicating with candidates via email. Please check your emails weekly for eligibility updates. Authorization to test information for approved candidates who have submitted their applications before April 1st will be sent out on Monday, April 20th. And now we are going to move on to discuss the CPM exams. So we received many inquiries regarding the May CPM exams. ABC has made the decision to postpone the May session to July. The new dates are as follows. For orthotics, it will be July 23rd to July 25th. And for prosthetics, it will be July 30th to August 1st. Notification of these new dates was emailed to all registered candidates last week. Information will be emailed to all approved candidates and deferred candidates by June the 1st. Please note that ABC will try to accommodate all registered candidates as best we can, but we are limited to a specific amount of candidates for each session. Also, please contact us if you wish to defer to the fall session, which are occurring in late September for orthotics and early October for prosthetics. Earlier in the presentation, I informed everyone to check your emails for eligibility updates. So we will now discuss eligibility status and what that means to you. There are 3 ways for you to check your eligibility status with ABC. You can check your email, log into your MyABC account at abcop.org, or view updates in your online application dashboard. There are 2 statuses that you may see when you check your eligibility: approved or pending submission. We will discuss what these 2 statuses mean on the next slide. If you have an approved status, that means no further action is required on your behalf. You will receive correspondence from ABC regarding the test site selection process. However, if you have a pending status, that means we have insufficient information to complete your application, which could mean one of the following or possibly both. You have an incomplete NCOPE residency, or we are missing your official transcript from your KHEP accredited program. We will discuss an incomplete NCOPE residency first. An incomplete NCOPE residency notification means that we have yet to receive confirmation of your NCOPE residency completion. As a reminder, ABC allows an additional 30 days after the application deadline to complete your residency requirements. If you are unable to complete your residency by the deadline, please contact us immediately. We will work with you to determine the next available session that you will be eligible for. Your residency must be complete for exam eligibility. No exceptions can be made. We will now discuss missing transcripts. A missing transcript notification means that we do not have an official transcript from your KHEP accredited program to complete your application. As a reminder, we also provide an additional 30 days after the application deadline for you to submit your official transcript. We understand that the majority of the KHEP programs are not fully operational and their services may be delayed due to COVID-19. If you are unable to provide an official transcript to us, we'll accept a formal letter of graduation from your registrar's office until an official transcript can be provided. This letter must indicate your conferral or graduation date and must be on official letterhead. If you are unable to get in contact with the registrar's office, we will also accept a letter from the program director. Please note that we must have your official transcript before you can sit for your exam. You can upload your transcript directly onto your online application dashboard or email us. Once you have submitted all of the required information, your eligibility status will then be updated to approved status. This slide here provides information regarding exam dates and deadlines for the remainder of 2020 for current and future applicants. As a reminder, this information is also available on the individual certification page of our website. Please pay close attention to the application and residency deadline for the exam session that you are seeking to apply for. You must apply by the application deadline for that session. However, we do allow an additional 30 days for you to complete your residency, as indicated here by the residency deadline on the chart, and also to submit documentation such as your transcript. So don't worry if you don't have your transcript or residency completed by the deadline. You still have time. For future applicants, remember, you can apply online at abcop.org 24 hours a day, 7 days a week. And here are some important reminders for both current and future ABC applicants. You can upload documents directly to your online dashboard or email us at certification@abcop.org. You can check your status by logging into your MyABC account at abcop.org, and please allow 4 weeks for application processing from your submit date. And most importantly, please make sure that your contact information is up to date. We'll communicate with you by phone or email. And thank you for your time. I'll open the floor to answer any questions that anyone has.
But our first question for the ABC team is, does an official transcript need to be uploaded for each exam, or does ABC retain copies of that official transcript after signing up for the first exam?
That is an excellent question. If we already have your transcripts on file from a previous application, we will reference that for a period of 7 years.
Very good. And another question for ABC's team. Do you plan to offer additional CPM dates throughout the upcoming year to offset the potential shortage of opportunities during COVID-19?
We are monitoring the situation. In the event that we do need to open additional testing windows to accommodate candidates, we will inform everyone on our website or through email.
Good question from one of our residency directors is, can residents conduct research on best practices, for example, prosthetic clinical best practices for prosthetic residents, using available data within their existing software in lieu of actual office time and patient contact hours? If so, what percentage of clinical time can be replaced with this research activity? Excellent question. One, there's never been any definition within the standards of NCOPE of a percentage of time that needs to be face-to-face patient time versus, for example, farming data from your electronic medical record system to assess outcomes and aggregate data sets, for example. So those ratios have not been defined at any point. So can this activity be part of the residency? Absolutely. Is there a maximum or minimum amount that this activity can occur? No. I think the one thing that I want to just clarify is when you're a resident, NCOPE is the accrediting body. Your residency program director is the institution. They actually do have academic liberty, autonomy, and power. NCOPE defines the minimum standards, but as written, the NCOPE standards are designed to be flexible, as even before COVID-19, there was considerable variability in the volume of patients that would walk in to the door, et cetera. So as a director, you are fairly well empowered to actually engage in learning activities that aren't the more traditional, busy face-to-face clinical practice. Now we had a follow-up and actually a related question. Are any residents or residency sites using this time to improve their clinical outcomes and process? There was an inquiry about residency programs pursuing integration of outcome measures and other best practices. And I believe this relates to the notion of being engaged in research and potentially leveraging and farming data from EMRs. This is certainly a possibility. I have actually spoken with a few residency sites that are looking to implement more consistent measures within the patient populations they see. And this activity would certainly count towards a learning activity based upon the judgment of the residency director as well. As if they've already covered it, and the director says, you're not going to learn anything new from that, you, the director, reserve the right to say, let's do this instead. What has driven the reduced number of testing sites across the United States?
That is actually a very good question. In response to COVID-19 and for the safety of everyone, Prometric has actually decided to close all of their testing centers until May 1st. They will slowly be reopening all of their facilities after May 1st, but they are going to be following the social distancing mandates where they're going to be operating at half capacity. So that could be a reason why a lot of the candidates are unable to see an available testing center that was open, let's say, in February for them. They're slowly but surely trying to get all of their testing centers back open.
Very good. Thank you, Samly.
You're welcome.
Another question from our audience pertaining to the ABC exam is ABC exploring, or do they have the ability to offer any sort of discount or fee waivers in light of financial hardship that may result from COVID-19?
As of now, we are not offering any discounts or waivers, but if you are facing any financial hardships, please reach out to me and we'll see what we could do in regards to helping you with that.
And that same individual had a great follow-up question. Is there any hardship or fee discounts or waivers in place for NCOPE? And for that response, I'd like to ask Ms. Mungo and Ms. Seabrook.
This is Robin Seabrook. Hello, everyone. I would echo exactly what Sam Lane stated, that we would need the individual to reach out to us, and we would see what we need to do and what ability there may be. But as you can imagine, NCOPE also is an extremely small nonprofit, and the activities of what we do are sustained by our fees. That being said, we do want the ability to assist where we are able. So I would have that individual reach out to us.
And we have a question regarding experiences during the NCOPE residency, in particular, professional activities and quarterly clinical track activities. How do we engage in our quarterly clinical track activities if these require face-to-face interaction? And to that, my response would be writing a critically appraised topic doesn't require face-to-face interaction. A journal club or review session can be done online. And in-service even can be done online. I've had several residents already do in-services for orthopedic groups, for example, via Zoom meeting instead of performing that on a face-to-face basis. Interestingly enough, we've even had a couple of residents say, Chris, with all this downtime, can I do multiple quarterly activities now? So when the patient care ramps back up, I already have them done. And to that, we say yes. If you would like to complete more than one quarterly activity when the volume of patient care may be somewhat lower due to COVID-19, NCOPE would wholeheartedly welcome them. To piggyback that question, we had an individuals asking about professional activities in particular. With regard to the professional activities, which is either volunteering for an orthotic and prosthetic organization or engaging in outreach to schools to provide O&P awareness, some individuals have said that the schools are closed. I don't know how to do this. My response is, I don't know about the school district by you, but I can tell you my children are still in school and they are doing online learning. And actually, career awareness is something that the teachers have been very vocal about asking for, as it's quite a bit more interesting than doing mathematics or multiplication. So I'm not certain that that opportunity is off the table if you're in an area where the children continue to go to school on an online basis. Furthermore, a lot of the O&P organizations still need help, actually arguably more. I've spoken with several NGOs, non-governmental organizations that provide international care and outreach. And while the care is certainly one aspect of what they do, fundraising is actually something that they are looking for help with, and communication and marketing, because since they don't have that face-to-face opportunity, harnessing online platforms such as Twitter, Facebook, social media, blast email campaigns, that's something that they would very much appreciate the assistance on. So again, I'm not certain that there's a lack of opportunity, although I can tell you we are working to actually compile a list of potential O&P organizations that are seeking volunteer opportunities that can be performed remotely or utilizing online. We have a question for our ABC colleagues. Can recent graduates still take the combined written exam, or has that exam been placed on hold due to a decrease in available testing centers?
We definitely encourage recent grads to apply for the combined exams. They are still being offered for both the May and the June session. So definitely apply, apply, apply.
We had a follow-up question regarding our quarterly activities. For quarterly activities such as Journal Club, would there be a way for NCOPE to organize a communication platform? One thing that would be potentially interesting is to take advantage of some of the free software that's been made available to the public at large. Zoom meeting, for example, which all of us are on right now, has removed the time limits for meeting durations. So you can have up to 100 people for as long as you'd want for free. utilizing Zoom meeting right now. So the platform is there, but it sounds like you're interested in finding a way to actually identify fellow residents and directors to engage in that process. And to that, I say it's a good question and let me look into it. I kindly ask that the person that sent me that message shoot me a follow-up email. It's crobinson@ncope.org. It's on the website too. But I like what you're thinking, and apparently so do quite a few of your peers. They said that's a great idea. We have a good question from one of our residents. How can we include other projects that we're working on, such as patient brochures to discuss volume management, or creating supply chain tools to address our actual volume and inventory within the clinic? We will have a new form made available in the near future. Next week, it'll roll out for what we're calling non-clinical activities, activities that aren't face-to-face with the patient, but you may be implementing a barcoding and inventory management system, for example. The question is, do we need to be paid for 37.5 hours per week by our residency employer to be considered a full-time resident, or do unpaid educational experiences count towards residency?
It may be possible. Again, that would be at the discretion of your residency director, provided they have a plan in place for those educational opportunities that are not direct patient care. I would say that it is a possibility.
Yes, and I would add, thank you, Dom. I would add that, we want to assure that if it's an agreement and understood between the residency site and the resident, and you're meeting what labor laws, all of that have been checked, and the educational experience, and it's an agreement that, between the resident and the director, that it's an educational opportunity, then we would support that as long as everybody's on the same page.
And a related question is, will non-clinical documentation, for example, journal reviews, is there a mechanism to allow us to backtrack and log those activities in the event we've been doing a volume of those activities prior to the form being released next week? And the answer is yes. At present, NCOPE Tracker for your clinical encounters, as well as NCOPE Tracker for your non-clinical, will allow you to backlog and enter information all the way back to the actual start date of your residency. We have a question for our ABC team. When are the deadlines for recent graduates to apply for the May or June combined exam? And when taking the combined exam, may I also take the written simulation if I am a recent graduate as well?
All right, thank you for your question. So for the June session, our application deadline was April 1st. However, we are still accepting applications until the end of the month. So if you have yet to apply, you may do so. If you are taking the combined exam and is hoping to take the simulation and the CPMs, please note that you do need to have your residency completed by the residency deadline and to apply by the application deadline for that session that you're seeking.
We have a question about, is it possible for NCOPE to update the list of available residencies in the incoming months or provide other resources for individuals that need to find a new residency site? I'm pleased to say I can, on this list, count at least 4 dozen residency directors and mentors. To that I say, 1, the directory on the NCOPE website is up to date. It is a directory of all accredited programs. It was intended from the release of the new website on January 1st to list who's hiring and who's not. The way to identify who is hiring and who is not, unless you work for Hanger Clinic, is OP ResCast. If you work for Hanger Clinic, please contact Mr. Reber to share opportunities that may exist. Everyone else, OP ResCast is how it should be configured and created. And if you are a residency director thinking, I have an opportunity, I got to get the word out, don't hesitate to reach out to me and get on the system, as we have a pool of individuals who are very much interested in this opportunity. I've gotten no fewer than 6 messages privately and publicly that they would love to have the chance to know who is looking for residence, because a few individuals, unfortunately, aren't going to have the opportunity to continue their residency at a current site, or the opportunity that they were going to begin this summer is no longer available. Excellent question. I have a good ABC question. For clarification, to take the simulation and CPM exams, if my residency end date is July 10th, am I going to have to wait until October to sit the simulation and therefore not be able to sit the CPM this year?
That is a good question. So we are under the impression that NCOPE can mark your residency complete up to 2 weeks prior to your actual end date. Space permitting, if your residency end date is marked complete by, let's say, July the 1st, we can think about the possibility of getting you into the CPM exams. Again, that is space permitting. Regarding the simulation exam for October, the deadline is September 1st for your residency. You can take your exams in any order.
Thank you, Stanley. We have a question for the NCOPE team that I'm comfortable answering. If we're still achieving a typical volume of patient encounters because COVID-19 has not been as affecting of that region, do we still need to log any additional non-clinical encounters in the system? So long as your patient volume is consistent and the numbers are consistent with previously, no, you do not. If you have seen fewer patients per week, then yes, you should absolutely be logging additional non-clinical experiences or encounters within the system. Also keep in mind, this form and tool is designed to create a longitudinal timeline and portfolio for you as well. It's not just for NCOPE's knowledge. If you're at a residency site where you know you may not stay forever, having somewhere to write down, I created a new EMR platform tool. I've implemented a telehealth platform. Those are aspects that you can actually pull from the documentation and share for future employers. So it tells the story of your residency as well. I encourage you to share that. We have a good question for the ABC team. Do the written simulation exam need to be taken and passed before CPM eligibility?
No, you can take the exams in any order, and passing one of the exams prior to taking the other is not a requirement.
We have a question. What is NCOPE's expectation for backlogging non-clinical activities? Well, to the original slide we shared, NCOPE has not changed their standards. We've always expected you to log 100% of your cases equal to or greater than 15 minutes. If you look back at your encounters and go, I could have done a better job, now's a great time if your volume is slow to catch up. So what is our expectation? On the last day of your residency, 100% of your patient encounters equal to or greater than 15 minutes are in NCOPE tracker. And that has been our expectation and has not changed in any way. But I hope that if you do have a bit of downtime, take advantage, because catching up on tracker, that's technically a residency activity and can count towards your 37.5 hours too. Excellent question. We also have a question regarding the potential of hour reduction. The extension calculator tool that Ms. Mungo shared, they were curious if the tool was able to account for incremental changes. For example, over the course of time, they may have 30 hours a week for a period of 2 weeks, and then 20 hours a week for a period of 2 weeks, and then ramp back up. There's variability. Can this tool account for variability? And to that I say yes, so long as you know the average number of hours over the period of time when you're reduced. So to my example of 2 weeks at 30 hours, 2 weeks at 20 hours, you could document that as 4 weeks at 25 hours per week average, and the calculator will spit out an appropriate answer on whether or not extensions are going to be necessary. Wonderful question, and I'm going to give this to Ms. Mungo and Ms. Seabrook. Can additional education count towards residents who may have been furloughed or lost their employment? In the case of these individuals, Do they have the ability, after being terminated or no longer paid, to continue to accrue towards their completion of residency?
Okay, I would speak to a situation of someone who has been terminated. Actually, if your residency is terminated, then it's no longer current. And then at that time, we're not tracking you per se. And so we aren't expecting to receive any evaluation forms or requirements from you at that time once you say that your residency has been terminated.
And to piggyback Ms. Mungo's statement, during a period of time when an individual has lost employment or been placed on furlough, there are also potential local, state, or federal labor laws in place.
Absolutely.
None of the NCOPE staff are attorneys licensed in any state where there is a residency. It is important to consult the legal ramifications and even the challenges of risk management in having an unpaid person present during learning opportunities, whether it be direct patient care or other. So please communicate with appropriate legal and risk management personnel as well, as NCOPE cannot guide or direct that. On the website for NCOPE, under the COVID-19 resources, it states that I might be able to reduce my hours without extending my residency. I was working 45 hours a week, which is more than 37 and a half, for several months. I can count these hours towards my completion on time, right? And my answer to you is absolutely, you can count them, but you need to prove that you've in fact worked beyond full time. To do that, you're going to have to provide a de-identified patient schedule, meaning we need to know the intervention and appointment type. Was it a transtibial follow-up, for example? We don't need to know the patient's date of birth or name, as we don't want to violate PHI, but that schedule should demonstrate that you were in fact working more than 37 and a half hours. 2, every single patient on that schedule needs to be in tracker. If you give us a schedule of 44 patients and there's 40 patients logged in tracker, that's not due diligence. We do need all of that information logged. And 3, there's an attestation process as well. We are going to need to have those residents and their directors submit an attestation. And just a friendly reminder, an attestation says you verify that this is in fact true. I have worked extended hours. And all residents are bound by the ABC Code of Professional Responsibility. So please don't lie. Ms. Kedavon and our ABC team, would you like to provide any closing thoughts to our attendees?
Yes, thanks, Chris. On behalf of ABC and our board of directors, we thank you all for attending, and we would like everyone to know that we are thinking of everyone and hoping that everybody is staying safe. As a reminder, please be sure that if you have any questions in regards to your exams or anything ABC related, to contact us. Our contact information is here on the screen. And also, if you have any concerns about any ABC programs or the impact of COVID-19, please be sure to check out our COVID-19 landing page on our website for the most up-to-date information.
Excellent. And I am getting some great questions still. I do want to have Ms. Mungo offer a closing thought, and I will get to the questions from the 3 individuals who are kind enough to share them. Dominique, do you have any closing thoughts, or Ms. Seabrook?
Thanks, Chris. I would just like to also thank everyone for their time today, and let you know that you do have NCOPE support during this time. And, you know, our staff, as always, is available, you know, by phone, by email, any way possible. We're happy to answer any questions and assist you through this time.
Excellent. And a great question for our ABC team. If ABC does find the need to cancel the July and August CPM exam, how soon would they be alerting the candidates?
That is an excellent question. In the event that we do need to cancel or postpone the July and August CPM exams, we will email the candidates as soon as possible once we make our decision. So I encourage everyone to make sure that their contact information is up to date and check their email daily or weekly.
Thank you, Stanley. And we had a couple of good questions about documenting experience beyond 37.5 hours per week. With regard to having the supervising practitioner's name on the schedule versus the resident, you are able to provide that information with the supervisor, and then you will simply have the attestation. The key here is if your supervisor's schedule is something where you attend 100% of them, it's going to be very easy to say, I attended all these cases. If your supervisor has a schedule where you were only present for 60% of them, you're going to have to do a little bit of explanation and copying and pasting to do this. Now, when we talk about the schedule information, how do I verify that I was over 37.5 hours a week? There'll be the ability to upload a PDF of that information. So the NCOPE staff is going to need to review these manually. But if it's a function of doing a screenshot and then copying and pasting, or exporting something to Excel and saving it as a PDF, we can accept it multiple different ways, as long as you have a way to convert it to a PDF. And then a good follow-up question for ABC. We discussed the communication of canceling the CPM exam. If Prometric finds it cannot open for May, when will they notify the candidates hoping to sit the May exam?
In the event that Prometric cancels the May session, they will actually communicate with ABC first. We will actually be your liaison between Prometric in regards to any rescheduling of your exams. So be on the lookout for an email from ABC if anything is to happen with the May exam, whether it be canceled or postponed.
Thank you. And the audience has been very gracious in extending many thank yous to our chat window. We sincerely appreciate it. On that note, we're just about out of time. But one thing that we would like to remind you is the staff is here to help you. So in addition to the email addresses we provided earlier on, the entire ABC as well as NCOPE staff is listed on our websites. And furthermore, we have contact forms available so that you can reach out to us. And they'll even be routed to the right people. So if you email NCOPE and say, I have a residency question, we promise that that information will be given to the appropriate staff members best able to address your concern. And ABC also has that ability as well. Do keep in mind, we are getting a fairly large volume of inquiries, but we do strive to have a response within 1 to 2 business days between both organizations. On that note, I'd like to thank all of you for your time today. It was an honor and pleasure being able to share information and also understand some of your questions, comments, or concerns. We know that this is a fluid situation, and you might have additional questions, comments, or concerns. So again, please don't hesitate to reach out to us, and please do continue to visit our websites as we'll update and provide the most relevant information for you. Thank you so much. As your moderator, this is Chris Robinson, signing out.